reports show infant death rates in Michigan were lower in 2023 than previous years. And while that's certainly good news, the infant death rate is still too high. 13 on your side's Elena Holland spoke to a group of medical professionals working to reduce that rate to zero.
For every 1,000 live births in Michigan, 6 infants die before their first birthday.
We're one of the top 10 states in the country that still has a high rate of infant mortality.
But that number is decreasing. During the early 2000s, the death rate was nearly 8 deaths per 1,000 live births. But that was even a significant decline from the 1990s, which saw 10.7 deaths per 1,000 live births.
So we still have a long way to go.
That's why SOS Maternity was created. It's a healthcare collaborative combining knowledge of 14 maternal-fetal medicine universities and healthcare systems across the state.
It's a really complex problem.
Dr. Sonia Hassan is the lead at SOS Maternity. She explains the leading cause of infant mortality is babies born preterm or before 37 weeks.
We know that there are things that we can do that can reduce that risk by 40%.
And also, help save the lives of the mothers as well.
Dr. Lisa Thiel, a maternal-fetal medicine doctor and primary investigator for research at Corewell Health West. She says 2 big ways to reduce preterm labor is measuring cervical length for the mother early in the pregnancy and a daily use of prescribed aspirin to reduce blood pressure.
Helps decrease inflammation of the placenta and decrease the risk of preeclampsia.
SOS Maternity is also working to bring down barriers for patients to access to prenatal care.
We've seen a decrease in the number of providers for women's health, and so we also see these kinds of pockets of what are called, care deserts, where patients aren't able to access the kind of care that they need.
They're working to get patients transportation, as well as a patient navigator for the healthcare system.
It's frustrating to know there are things out there that work and patients aren't getting them.
Reasons for infant death other than preterm birth are birth defects and assaults and accidents. SIDS, or sudden infant death syndrome, has remained low, only about 4 deaths per 10,000 live births for the past 10 years.
We really want to make sure we're targeting those areas and making the biggest impact that we can.
Great to hear that we're making some headway. For a long time that wasn't the case, but it also gives us hope to know that there's a possibility to improve it, and that the things that we're doing and the efforts we're making can actually start to make change.
Elena, what else is SOS Maternity working on?
It's also worth noting there is a persistent racial disparity in which Black mothers are 3 times more likely to have an infant die compared to white mothers. This and addressing the rural challenges to healthcare are priorities for SOS Maternity going forward.
Thank you, Elena.